One of the themes I'd like to discuss is the quality of the public health system in regards to mental health and treatment for mental illness. Kate was for longer than 15 years and still is a consumer of our public health system as a result of her chronic illness. Kate's story shared that although the system is aiming to address mental health and invest more resources and time to it, that there is still a massive amount of improvement required in quality and type of care provided. On many accounts, Kate expressed forms of deprivation from clinical professionals. This included being denied surgery because a surgeon decided self-harm was not a worthy cause. And when questioned by Kate, "Would you have surgery if you were in my position with this injury?" responding yes, he elaborated that it was not cost-effective for the hospital because Kate had a history of self-harm. Furthermore, when Kate talks about her friend Zoe taking herself to the emergency department because she had self-harm, she discusses that she waited 3 hours to be seen, to be left in a room with boxes of scalpels and needles, to then undergo the initial stages of her stitches without the anaesthetic kicked in, as the doctor did not have time to wait. And when she expressed to the doctor that it was painful, he responded with, "It must have hurt to do it in the first place." To gain insight into these detrimental events that these already vulnerable individuals are exposed to has a very large impact on my professional identity and how I wish to conduct myself as a therapist. Secondly, the influence of meaningful occupations on recovery was another theme that was regularly intertwined in Kate's description of her recovery. Several times throughout the book, Kate discusses how her occupational participation and engagement changes from the type of occupation she engages in to the meaning associated with the occupation. A big turning point in Kate's recovery was when she substituted yoga for the occupation of alcohol. This time in which Kate was engaging in the meaningful occupation of yoga was a time that reflected a stable period of her mental health. She was back participating in productive occupations such as work and personal care. Another occupation and an identified interest that was a consistent theme in Kate's recovery was music. Music was identified as an interest of Kate's and appeared to have rich therapeutic powers in Kate's life. Kate referred to it as something that keeps her grounded. From a therapeutic lens, this strength of Kate's could be used to direct recovery and increase her engagement in the recovery process. This is known as a strength-based approach. Furthermore, rapport. Rapport was something that was highlighted throughout the book, both negative and positive. The crucial need for rapport between therapist and client is emphasized in the novel. The negative effects of a lack of rapport between the two can be seen when Kate describes her experiences with psychiatrists. Specifically, Kate discusses that she does not understand how a professional can expect someone to open up and discuss the most terrifying things in their life and very personal subjects when the professional does not even acknowledge them as a human. She emphasizes on the importance of a person-centered approach in therapy, ensuring the person is, quote, an active voice in decision-making and is given clear and honest information. The benefits of rapport were seen in Kate's recovery when she met Winsome, her most recent psychologist. This was illustrated as another turning point in Kate's story where she began to trust her therapist, which soon led to Kate valuing what she said and acknowledging her mental illness, which was not done prior. Within Madness, a Memoir, acceptance and commitment therapy can be seen in Kate's therapy sessions with Winsome. When Winsome focuses the therapy on teaching Kate how to recognize what the start of a psychotic episode may look like and teaching her how to manage the symptoms rather than avoiding or ignoring them. Personal causation was yet another theme identified, and Kate's view of herself and her abilities shifted throughout the book. In the early stages, she appears to deem herself as a burden to her family, not capable of working for a short time, and believes that she's not capable of recovery. In the first described admission to the hospital in the book, she has a discussion with the doctor as follows: "I should be dead. It is a process of a natural selection. It's in my DNA. I was born wrong." This sheds light on the way in which Kate perceives her self-worth. This changes as she experiences a positive relationship with Winsome, her therapist, where she begins to make serious progress on her road to recovery. She alters her view of herself to a capable view, that she is capable of recovery and that she can live with the illness, and that she can live a productive life participating in the occupations she wants to, such as work, travel, self-care, and playing music. And this was where ACT was seen again. So acceptance and commitment therapy. Prior to her sessions with Winsome, she knew that she was ill, but she was somewhat in denial, and she never openly discussed the voices that she was hearing in her head and how they impacted the decision making and the behaviours that she was displaying. And with the rapport that she did gain with Winsome, she felt comfortable enough in the end of the novel to actually discuss the voices that were in her head. And then this is when she led to learning to manage them, learning to identify the symptoms that signified an episode. So in regards to values as well, throughout the book it's evident that Kate's family are a core component of Kate's life and that she values them very much, along with the social connections of her friends and the support that they provide as well, and assisting her in recovery. Furthermore, Kate's roles were a massive theme throughout it. Kate's roles in the novel were always changing. The biggest shift in roles was from medical professional to the patient. Kate was previously studying as a doctor and was now the patient of many professionals. She lost a sense of purpose along her journey and had a low perceived self-worth. I believe that Kate struggled with her shift in her roles throughout her illness, and she was previously a high-achieving medical student who was working and an active member of her family and friend group, to then becoming a closed-off individual without employment for a period, less social with friends and family, and not fit to work as a doctor. However, Kate was also a daughter, a friend, and a carer of her cats.